I am Ivan Seidenberg, and I'm here in my capacity as chairman of the Health and Retirement Task Force at the Business Roundtable. We're here to talk about health IT. Of course, we have Senator Kennedy and Senator Enzi with us. It's my pleasure now to introduce Senator Kennedy, who will explain the details of the bill that we'd like to talk about this afternoon.
Just very quickly, this country has to deal with the healthcare challenges that we're facing. And I think that we have seen in the national campaign, whether you're a Democrat or Republican, we have candidates that have talked about it and are concerned about it, and they have, no matter from what vantage point they're coming from, all indicated this would be a high priority in the next administration. And we are prepared, Senator Enzi and I and our committee is prepared to be a constructive and positive and to try and find common ground in this area as we have in other public policy areas. The country really requires it. That hasn't always been true in the past. The Business Roundtable obviously can have enormously constructive and positive role, and we're very eager to involve the Roundtable in the broader kinds of issues on health policy, but also in the particular issue on information technology. So much money is out there in the system. It isn't additional kinds of resources. It's basically trying to find the ways to marshal the resources that we have into efficient and effective kinds of delivery systems that is going to make a difference in terms of quality, going to make a difference to get a handle on costs, increase our competitiveness, and most importantly, give the American people the kind of health care that they deserve.
You ought to be able to carry a little card like that would have every record about you on it, including ones that you want to put on or that you want to critique. And it should be usable anywhere in the country. Now that's the problem. There are health IT systems out there right now. But if you're from Wyoming and you come to Washington and you break your leg, the doctor's not going to be able to read it because it's got different standards. So what we need is a standard that can be used all over the country so that your information can be read everywhere. Now we're having a little difficulty passing it because there's an increased interest in a few of the items like privacy. But what we're really talking about is data security. And you already trust data on a lot of your life, two different kinds of actions that happen on cards without giving it a second thought. And it will be a challenge always to make sure that there's good data security. The bill that we have takes care of data security. There's no reason we can't have health IT and have it right away. There's some costs involved, but we told you about the savings. And those savings far on an annual basis exceed what it would cost to put this in. So we got to get health IT done, and I appreciate the Roundtable's help on doing that.
One of the things you might be interested in is when you think of health IT, it's not only the digitizing of the information, but it's allowing it to be, as it was explained, interoperable. So you take a blood test in the district, it's coded the same way as a blood test in California. And this way, when you have, you're treated in one location or another, people have the basis to understand what you are allergic to, what medicine you can take, and so on and so forth. So from a business standpoint, key point I would make is when you introduce IT into a whole industry like this, you're looking at somewhere between 20 and 40% savings in administrative costs and improvement in quality of treatment of customers. And you start out saving 20% and you drive it up to 35 or 40%. So as Senator said, there's plenty of capacity and capability in the system to take the things we're already doing and just create these standards that we're talking about. And the issue of security and privacy is easily handled with the techniques and the advancements in software technology and systems that we know how to put in place to protect people.
But this fundamentally is about really improving the quality of care that citizens in America receive so that they're getting access to really the state-of-the-art and the decision science that physicians really have available to them.
The vast majority is self-funding because most of the most of the healthcare institutions are already spending a lot of money on IT. So what we need are the standards to be set, which HHS could do, And I also understand there's also some grant money available to smaller clinics and smaller healthcare associations to be able to get started and create some seed money for it.
We are basically stalemated with the privacy provisions in the Judiciary Committee. The basic thing that's holding us up now are the privacy provisions in Senator Leahy's in the Judiciary Committee, and that it is not moving at this time.
Because the thing we need to do, rightfully so, is convince those who are concerned about privacy that the customer and the patient will have control of the information, and the systems will be secure, and that people can't break into them and get information